And as Jeff Zients has been briefing from the White House with some important announcements, joining me now to run through all of this, Dr. Kavita Patel, former health policy director in the Obama administration, who works in a clinic and is on the front lines here in D.C. Dr. Patel, what I heard, first and foremost, is that 1 million doses are going to be made available to pharmacies around the country starting February 11th, that's next week, to make this more readily available. People can go on their local pharmacy website. There will be perhaps a better trust aspect to this for suspicious communities. Equity will be part of the CDC's decision-making as to which pharmacies in America are going to get it. So they're going to go to pharmacies in neighborhoods where they're trying to get more people, presumably minority communities, tribal areas where they're trying to get people who have not yet had access to vaccinations. That's first, and also that they're going to make FEMA available to try to get to improve the distribution effort once it gets to the states out to the communities that need them. Are those the top lines to you?
Yeah, absolutely, Andrea. And I think just critical to remember is people might confuse this with the previous relationships announced with CVS and Walgreens. Those were primarily to allow those pharmacies to be able to vaccinate long-term care facilities. So this doesn't replace that. But to your point, exactly as you stated, Andrea, it's supposed to open up kind of new channels of distribution. And this is the federal government doing it directly with these pharmacies. And I do think it'll open up just an incredible opportunity. In the beginning, as I think Jeff Zients was appropriate to point out, it is going to be way more demand than supply because it's a limited number, 6,500 with only 1 million or so doses. But I think the foundation can get laid there, Andrea, so that it is much more accessible. And potentially these are pharmacies that know how to do it. And so these portals and all this confusion should be a little bit better by expanding it directly to those. And we didn't know which pharmacies, but I imagine it'll be a cast of pharmacies that have that widespread net, to kind of your point, in different communities across the country.
And it's really building on something that was tried, at least in West Virginia, which has been so good on the distribution. They've been using pharmacy groups in their community. They didn't go with the initial federal system. So kudos to the White House for at least trying to build on something that at least has shown that it works. Obviously, this does not solve the problem of all the money that's in that bucket that they're trying to resolve in Congress right now. Dr. Patel, I'm just wondering whether you're seeing any increase in acceptance in the communities you serve now that there's been an attempt at better education on that these vaccines are not dangerous, and that especially with the surge that we are anticipating from the UK variant, which is out there in the community, even though we have not been doing enough genomic sequencing to know exactly where and how much. This could be getting really bad in the coming months.
Absolutely. And so, Andrea, what we're seeing is just more honest conversations. They're taking time. So one of the things that kind of we've been giving feedback to states and to the White House and others is that we need to allow for these questions and conversations to happen. Andrea, imagine anything as sensitive as your concerns about a vaccine and trying to do that in 10 minutes or less. We want to have, and I had a 40-minute conversation with somebody who was really nervous, and I had to talk through all the issues, which are incredibly important. So this is going to take time, but it is helping to be able to have somebody that knows you answer the questions, and to do it in your native tongue, or to do it in a way that you can understand, that's not necessarily kind of what you would see on a website. I think that's exactly how we're cracking at this resistance. But I think you're hearing from me and from others that it's definitely going to take time, and we don't have time against these variants. So at the same time, Andrea, public service announcement number 10,000, if you do get a vaccine, wonderful. They're liquid gold. They're highly effective. You still need to stay masked and protected, and don't kind of release your guard, because these variants are posing enough concern to all of us that we need to continue as frustrated and fatigued as we are on those basic health measures.
Yeah, and just in an answer to a very good question, with the feds jumping into this, it's been a 50-state proposition until now. They are going to emphasize people 65 and plus, which is the common factor among most of the states, because 80% of the people who've been really sick and who've died from this have been in that category. Dr. Kavita Patel, as always, thank you so much.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.